Namaste everyone, my name is Namrata. So today we are going to practice a very beautiful and important asana which is Baddha Konasana. Baddha means bound, Kon means angle and asana is a pose. So it's a bound angle pose. And this asana is really good to open up your hips. It nicely stretches your hips, stretches your inner thighs, and it's good to release the tension which gets developed in these areas due to long sitting hours. And it's good for reproductive organs, digestive organs. It's really very effective for hormonal imbalance. It lengthens your spine. So it's very effective. So before we start, there are some contraindications like those who have hip injury, knee injury, or groin injury, lower back pain, or sciatica. They should avoid the practice or consult with your doctor or yoga therapist before starting the practice. So let's start. Before we jump into the practice, let's do some warm-up movements to open up the joints, to warm up these joints. Okay, slowly extend your legs in front, toes pointing towards the ceiling, spine straight. Place the palms by the side of your hips. Slowly straighten your elbows and look in front. Roll your shoulders back. And this is Dandasana, the foundational pose for all the seated asanas. Now from here, bend your right leg, place the right foot on your left thigh and place right palm on your right knee. Slowly, with inhalation, press your right knee down on the mat with the help of your right palm. Exhale, bring the knee closer to the chest. Inhale, press. Exhale, knee closer to the chest. Inhale, press. Exhale, knee closer to the chest. Inhale, press. Exhale, knee closer to the chest. Inhale, press, exhale, knee closer to the chest and slowly extend the right leg in front. Let's do it on the left side. Slowly bend your left leg, place the left foot on the right thigh and slowly left palm on your left knee. Inhale, press your left knee down on the mat. Exhale, knee closer to the chest. Inhale, press. Exhale, knee closer to the chest. Three more rounds. Inhale, press. Exhale, knee closer to the chest. Inhale, press. Exhale, knee closer to the chest. Strong. Inhale, press. Exhale, knee closer to the chest and slowly extend the left leg in front and sit in Dandasana. Now from here, bend both of your legs and bring the soles of your feet together. Your heels and your big toes are touching each other. Okay? And there's like half palm or one palm distance between your heels and your perineum region. Place the palms on your knees. Now with the help of your palms, inhale, bring the knees closer to your chest. Exhale, press your knees down on the mat and you can slowly, slightly bend forward. Okay, and spine is straight. Inhale, knees closer to the chest. Exhale, slowly press your knees on the mat. Few more rounds. Inhale, knees closer. Exhale, knees pressed on the mat. Do not force press, just a gentle push. Inhale and exhale. Inhale and exhale. Two more rounds. Inhale and exhale. Inhale and exhale. Now slowly extend the legs in front. First come to Dandasana. Now from here you can also place the palms behind your back and increase the distance between your feet. Look at the ceiling and relax for few breaths in Shithal Dandasana, the relaxation pose. Now once you are relaxed, bring your feet together again, palms by the side, Dandasana. Now from here, let's do the practice of Baddha Konasana. Bend your legs, bring the soles of the feet together. Okay. Now we have to catch hold of our big feet with our palms. So there are two variations of catching the feet with the palms. In the first variation, your feet are touching each other, your big toes, your heels, and you are catching hold of your feet. So this is first variation. In the second variation, the heels are still touching each other. You open up your feet, front of your feet, with the help of your palms like an open book and placing the thumb on the mount of your big toes and the other fingers are on the feet. Okay. So this is second variation of holding the feet. Do whichever feels comfortable. Now the heels are still touching each other. Now we have to bring the heels closer to the perineum region. So if you feel any discomfort in bringing the heels closer to the perineum region, you can slowly, slightly move your heels forward like a half palm or one palm distance from your perineum region and stay. So, because sometimes because of the tightness, you are not able to bring the heels closer to the perineum. So, do whichever feels comfortable. Also, now we have to press the knees down on the mat. So, if you feel like your knees are still lifting up because of the tightness, you don't have to hang them up in the air. So, what we can do, we can roll the mat from the sides and place the knees on the rolled mat. Okay. So this removes the tension. Also, if still you feel some lift, you can place the blocks, or you can also, if you don't have blocks, you can place the stack of books under your knees. Okay. So do whichever feels comfortable. Now I'm bringing the heels closer to the perineum region. So those who are able to bring the heels closer to the perineum region, you can place the palms behind, slightly lift up and come forward and bring the perineum region more closer to the heels. Okay, and press your knees down on the mat. Okay, now catching hold of our feet with our palms. From the two variations, just choose the whichever variation feels good. Okay, now roll your shoulders back, your elbows are closer to your body, and lengthen your spine. Look in front. You can look at your nose tip, Nasagra Drishti, or you can also close your eyes and feel the changes in your body. With every exhalation, feel that you are pressing your knees on the mat. Inhale and exhale. Stay there for a few more breaths. This asana is also known as Bhadrasana, gracious pose, and this is one of the four most important asana as given in our ancient text, Hatyo Pradipika. This presses the perineum region, the molar region, and is really effective asana for Kundalini awakening. Inhale and exhale. With every exhalation, feel the calmness. Inhale and exhale. Slowly coming back, open your eyes. Gently release your palms on the knees. With inhalation, bring your knees closer to the chest. And with exhalation, extending your legs in front and sit in Dandasana. Okay. Now we will do the second variation. Again, bending your legs, bringing the soles of your feet together. Okay. Again, like if you're not able to bring the heels closer to your perineum region, just do whatever feels comfortable, bringing your heels slightly forward and your knees, support your knees with the rolled mat or with the blocks. Okay. Now I'm bringing the heels closer to the perineum region and catching hold of my feet. Okay. Now in this variation, we have to bend forward in 5 counts. And when we bend forward, we need to ensure that our spine is straight and we are looking in front. Don't look down, look in front so that our spine will be straight. Okay. And your shoulders are relaxed. Okay. Inhale and exhale. Straighten your spine. Now let's bend forward in 5 counts. Inhale, exhale. 1. See the spine is straight and you are looking in front. Inhale and exhale. 2. You might feel some tightness in your hips and you might not be able to go further down. Then you can use the blocks. You can also use 2 blocks and place your forehead on the block. Okay. Choose the length, whichever feels comfortable, and be there. Okay, those who can go little bit more forward, let's do it. Inhale and exhale. 3. Your elbows are still hugging your body and you are still holding your feet. Inhale and exhale. 4. Inhale and exhale. 5. Now on the 5 count, your forehead reaching the mat. Okay. You can look at nose tip or you can close your eyes and be there for few breaths. Inhale and exhale. If you are able to reach till here, you can also further extend your spine and bring your chin to the mat. Stay there, whichever feels comfortable. Inhale and exhale. Slowly we will come up. Inhale, 1, exhale. Inhale, 2, spine is straight, you are looking in front. Exhale. Inhale, 3, exhale. Inhale, 4, exhale. Inhale, 5, exhale. Stay there. Inhale and exhale. Slowly, you might feel that your heels are coming little bit forward. That's perfectly fine. And when you bend forward, you might feel that your sitting bones are coming up. That is also fine. Also, you can place the folded blanket under your hips to give you certain length. Okay. Now slowly bringing the palms on your knees. Slowly with inhalation, bring your knees closer to the chest. Exhale. Bring your legs forward. Extend. Come to Dandasana. From here, you can place the palms behind your back, increase the distance between your feet, slowly looking towards the ceiling. You can close your eyes and take few deep breaths here. Inhale and exhale. Feel the changes in your body and come back. So this was the practice of Baddha Konasana. Thank you.